Thank you all. Thank you all for coming today for the conference. Uh, so uh, the next topic is little different from the actual medicine. It's more about the looking at healthcare delivery. The stakeholders are changing. So in that regard, the next topic is given by Mr. Rathnakar Samadevam. Uh, can I invite him onto the stage? Uh, Sir is not a doctor, but he understands more about healthcare than many of us. He's a chartered accountant by profession. He's a IIM Bangalore alumni. Uh, so the one person all youth should probably keep in touch is him. If you have any startup ideas in healthcare, he is the one who understands both aspects, whether it's doctor side of the health industry, so he can understand finances. I think he is bringing Bangalore to Hyderabad in terms of funding. So anyone who has an idea in health sector, wanting to explore opportunities, I think he is the man. So over to you, sir, to give your talk on this topic. Thank you.
For last 3 years very closely on various things, and currently I represent as investment director for Hyderabad Angels. We invest in startups. We are regularly monitoring what startups are doing today and how things are changing about. So one of the topic he requested today is how is the healthcare industry outlook and startup ecosystem in healthcare is changing a lot. The reason is I think you're all hearing startup, 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 especially 2020, 2021 has taken the startup ecosystem 500 times more than what it has happened over a decade. So that is one of the critical things that changed and masked a lot of things in this world, how the startup ecosystem is changing. And startups are also disrupting doctors and healthcare. I hope you all agree what really happening in this world. So one of the key thing, because we look into various reports before investing into startups, one of the key thing is the advent of pandemic. I think COVID has changed healthcare industry a lot. Not only healthcare, fintech ecosystem. You're hearing about fintech. Consumer has been changed a lot. So healthcare is no exception. And this has resulted technology. On one hand, technology as a backbone evolved to meet the necessaries of tough time. On the other hand, humanity became an assessing factor among many, where various medias were used to provide relevant and urgent solutions within the community. I hope you all agree with that actually, how things are changing. So when I look into our technology ecosystem, I think the phone has been changed a lot. When 1G came, it is the voice discussing between the two parties. 2G came, SMS. Two different parties can exchange the notes. 3G came, internet came on the mobile phone a lot, and we started using many applications. And iPhone got introduced in 2007, saying that through internet you can do many applications. And 4G has taken the advent to the next level altogether in this technology sector actually. And what we are all seeing is 4G. The apps are coming. Data is becoming a very important scenario for many startups today. So 4G is helping that. Now 5G is coming. It is changing a lot in 5G. 5G, what really people are saying is humans and machines will start communicating each other with the speed what really happening. And this communication between machines, human and machines is going to change a lot how we see our next 10 years or so. This decade is going to use a lot of difference. And we already seen changes in e-commerce. We've seen change in banking sector. I think you are closely watching what really happening over there. We are seeing very clearly changes in logistics space. I think you are all watching the speedy delivery and other things what really happening today. And the agri-tech is also changing a lot. Agriculture activity, agriculture production is changing. And healthcare is no exception. Healthcare already taking certain toll. And now more than 2 years, Sci-Fi innovations and important discussions have surfaced under healthcare. The healthcare market is predicted to raise 133.44 billion by 2022. That is thrice of FY21 because FY21 has given certain thrust. It is expected to grow 3 times. And digital transformation is going to definitely going to make a difference, what really we are looking. And this is one slide Government of India has put on their website why they need to come to India and look at India for the healthcare. They're saying that the healthcare market in India is expected to reach US dollar $372 billion. They are covering all facets of life, not only doctors, not only pharma, not only medical devices, not only diagnostic, not only pharmacies. They're saying the overall healthcare market in India is going to be 372 billion opportunity. And India public expenditure on healthcare went from 1.8% in 2020-21 to 2.1% of the GDP. So there is a lot of pressure on government of India to increase the spend on healthcare. They are saying we are going to do that and we are going to change. And one good thing happened, India has Bharat, Covishield and Covaxin, both came from India. And India is only the country which has done 100 billion population vaccination. I think that is a world, this thing everybody agreed. Today, China is still struggling with COVID. India is comparatively far better phase. And third is rising manpower. Yesterday there was a news, we crossed 140 crores. By next year, they're saying we are going to cross China in terms of people in the world. So we may be world number one in terms of people. And government is also coming with many policies. I don't know how many are really watching. There are hundreds of policies are coming to make ease of healthcare. That's what you need to observe. What is the biggest challenge today doctors are seeing is anticipated recruitment. I think most of the doctors said recruiting a staff is becoming more and more difficult, which they are saying. And enhanced competition from insurance companies, pharmacies, I think you can say pharmacies and other people have came, grocery stores, and other retail entities providing primary and virtual care. Now everybody has come into that area, and doctors have been really threatened. And most of the physicians who are working in hospitals burned out. This is the third year of their COVID, they burned out a lot. And they said, one of the survey both done in US and India, doctors said they are only spending 20% of the day on the patients, remaining 73% on the administration. This is one area they are complaining a lot. That's what they said. But this particular thing can be overcome with these various tools which are coming in the digital market space for the doctors. Digital therapeutics, I think you need to closely watch. There are many startups are coming in digital therapeutics. We want you to see doctors enhance their efficiency and time. That's what we are looking at. Consumer wearables, I think one of the key things they said is Apple brought ECG on their phone, which is giving some data, and it is going to change dynamics. Connected biometric sensors are going to come because of introduction of the 5G. You will get a lot of information. Smart cameras, computer vision is really changing today. You need to observe that very closely. Clinical trials, I think they are coming very aggressively. I think some of them are coming with very innovative paths. I think please watch out on the new startups which are coming in that. And I observed most of the doctors are not very active in startup world. I request they should become members of some of the angel networks and other things. Just observe what really happening in this space actually. And personal health records, web-based interactive programs, care team email and text messages, health system diseases, consumer mobile apps. I think this we are already seeing what really happening in the health space. I want doctors to observe this very closely, what really happening. And digital transformation, what a lot of people are saying, it's about meeting patients where they are, using digital technologies to construct, staff, and equip a hospital without walls. This has been discussed around 12 years back in US insurance meeting. They said they don't want patients to come to hospital, they want doctors to go to patients. Because hospitals have become a real estate places where they are making money on ICU rents, room rents and other things. That's why they're saying you need to equip that blends inpatient care with alternative models, including community and home-based care. In the future, patients and their families are going to assume responsibility of more of their care. I think most of your patients, you're aware, they're going to Google and searching what really is their disease. And they are going to need advanced digital tools that empower them to do what will be necessary and possible in future is radically different than what is available today. I think patients started seeing Googles, they started coming with various resources, they are watching their apps on the mobile app, what really happening on the health. All these things are changing. I want you to watch. What are the, now you are all hearing about artificial intelligence, which is coming very heavily in various sectors. In healthcare, what is that? Huge investments are going to happen by 2026. Robot assisted surgery. I think there is a 40 billion market opportunity which they are going to come. Virtual nursing assistants. I think robots are going to replace nurses. That's what they are saying. Administrative workflow. Already we started seeing a lot of changes in EHR and other things coming. Fraud detection, because patient records are growing very heavily into the digital space. They are looking at cybersecurity, and fraud is one area which they wanted it. Dosage error reduction, connected machines, clinical trial participation, preliminary diagnostic, automated image diagnostics. We started seeing investments in this space. Automated image diagnostic, preliminary diagnostic, clinical trial participation. In India, there are many companies are coming, investments are coming in this space. Robot assisted surgery, virtual nursing, administrative workflow is more happening in Korea and US. Maybe they are going to come to India very sooner. What really changed post COVID, both in US, Europe, and India put together, they did. They're saying we want to do a lot of activity with the doctor virtually. You can see the slides. Regular mental health visits, they want to do virtually 62%. Initial meeting with doctor, I think telemedicine you are observing, they're saying 52% wanted to have telemedicine as their this thing. Urgent care, even in urgent care, people are looking for 53%. Post-discharge surgery follow-up, they wanted to do virtually 47%. Chronic care check-ins, 51%. Prescription renewal, 62%. This is expected to increase. That blue line is expected to increase further in coming years. The reason is people who are born after 2020, they're seeing mobile phones. And they want to discuss people virtually, not physically. That is what we observed. Generation gaps are happening. That is the reason this is expected to increase further. Virtual thing is going to happen. I hope most of the doctors are preparing it. This is a small video which I don't know whether I can able to play or not. Okay. There is a small video on future of health. What they created is every equipment in the home, the mirror, the bed, the monitor, the machines, even in the toilets, all the equipments what they are using, they are going to give the digital information to you by 2030, and every patient knows what kind of medicine you need to take, what kind of adjustments you need to do on day-to-day routine. They are going to see. There is a video on that I will try to share. This is the major things which are happening in the healthcare industry. With regard to startup investment, what really happening? You can see the investments in 2011, which is 1.8 billion, it went to $64 billion last year, 2021. This is a huge jump in VCs with 900 deals across India, across the world actually. Huge money is pouring into healthcare. Please observe that there. So doctors are getting lot of efficient machines around them. And you can see US is clearly taking a lead. After US, China is second and India is third. I think you are not able to see because of little bit, but if you see total investment across the world, US has done almost $37 billion. China has done $12 billion. India has done almost $6 billion investment till date. No other country has got so much of investment. What India is, it is picking up very fast because of the population what we have as a consumer. And where is the venture capital investing today? A lot of people will be interested what investments are going from the VC world. Venture capital investment activity moved beyond telehealth to remote monitoring, AI first products, digital therapeutics and more. Here you can see initially started with digital care including telemedicine. Then it moved to remote monitoring and wearables. Drug development with AI, digital insurance, surgical robotics, clinical decision support with AI, digital therapeutics, hospital operations, patient recruitment and clinical trials, online pharmacies. I think you're seeing online pharmacies a lot. Home test, practice management software, and medical coordination. So each area, you can see the darker the circle, it is getting matured every year. where VCs are investing their money today in the startup world. And where is this investment went in India? And last year they said the Indian startup ecosystem closed with $42 billion. You would have seen in newspapers, in various meetings of the startup ecosystem, $42 billion have been flowed in. And one sector which has got big push other than fintech and e-commerce is healthcare. They received $2.2 billion in funding across 131 deals as per INC 42 data. So where is this, how many companies are there in healthcare? As per the government records, 3,548 active startups are there in health tech space as on today in India. And most of them which got benefited is online pharmacy. You all know PharmEasy, 1mg, NetMeds, all they have raised huge funds. 33% of the funding went for them. Healthcare analytics, 21%. Innova, sir, this is a company which manages employee database. And they give a lot of digital analytics to them. They have become a unicorn much faster than anybody else. Healthplex, I think, fix I've written. Healthplex is another thing most of the doctors have used. Fitness and wellness, CureFit, I think that is what one area they are doing. MedTech, Pristine Care is one of them. All of you know that they got 11.6%. Most of the junk they have taken care. Personal health management and telemedicine. Telemedicine at one time, it was number one in India around 4 years back. It started coming down because it became very easy. A lot of people started using. This is where the money is going out. So one thing which we are bringing to the notice of the lot of doctors and customers is with the explosion of direct to consumer business, using technology to empower people, to personalize their experience with company, healthcare also need to move into that direction. Patients are expecting similar experience, what Amazon, Flipkart, and other thing is there, but it is going to happen next 3-4 years. Apple has taken the lead with ECG monitoring device to bridge the gap between consumer tech and medical diagnostic is an important milestone today. They're saying this is very, very important using wearable. And as doctors and healthcare system more experience integrating this remote offsite modalities into more traditional practice model, I think we will see a redefinition what each patient medical journey looks like. Instead of going to doctor office for appointment and testing, telemedicine at home diagnostic will take streamline more stake in the company, in the healthcare system. And modern industry, the rivals which we are seeing the business world using artificial intelligence, putting patient first and digitalization of healthcare record is going to change the entire healthcare system today. This is what we are observing in healthcare industry. There are a lot of investments are going on. And as predicted in this decade, in next 3-4 years, the money flow for healthcare industry is going to increase by tenfold.